So we're talking about serotonin syndrome, and one of the things that really brought this, made it important for me to talk about this was the fact that I had a patient who nearly died from a tramadol overdose, and we'll know why here in a minute. So we know that with these drugs, they're inhibitors of serotonin uptake, and some of the mechanism here is the SSRIs, the SNRI, and TCAs actually inhibit serotonin uptake. They're inhibitors of serotonin metabolism, which can lead to increased levels, including the MAOs, which I think we rarely use, and lisinolide, which is often only used in hospital settings. There also are situations where there's increased serotonin production and release. You may remember the fen-phen fiasco. L-tryptophan and L-dopa increase it. And then there are serotonin receptor agonists, the triptans, fentanyl, buspirone. So most of us will tell our patient with a cough, right, take some Robitussin with codeine, or take some Robitussin DM with dextromethorphan. So interestingly, dextromethorphan, which is widely available over the counter, has about 40 major drug interactions. And it turns out that this drug is metabolized by CYP2D6, okay? And they've done some very eloquent studies to figure this out, but basically, again, this drug itself, dextromethorphan, has a number of actions, which are to basically be a norepiserotonin reuptake inhibitor and also an NMDA receptor blocker. So that's what dextromethorphan does. 90% of us are fast metabolizers. We get dextromethorphan, we throw it to dextrofan, and we're fine. But in those people who aren't or have an inhibitor of this, they can actually get increased levels and put them at risk for serotonin syndrome. And we've talked a little bit about some of these drugs, and just give you a few on the list. Again, the fluoxetine, paroxetine, duloxetine, sertraline, cimetidine, and bupropion. So in your patients' long-term use of dextromethorphan, you want to be a little bit careful. If they have signs or symptoms of serotonin syndrome, at least you have an explanation for it. It may be not all a cough and cold. So here's tramadol. Any of you prescribe tramadol? Okay, most of us, because we don't have many choices. All right, so its mechanism of action is that it is an opioid agonist. It is a norepiserotonin reuptake inhibitor, and it's metabolized through, guess what, CYP2D6. It's also metabolized through CYP3A4 and CYP2B6. In very high doses, it can actually inhibit the release of serotonin, inhibit the uptake as a SSRI and increase release of serotonin as well. So the dual mechanism. So tramadol in very high doses can actually induce a serotonin syndrome all by itself, even without a drug interaction.